Well, new COVID-19 cases continue to fall sharply in the Northeast, even as other states still battle a surge. Here to answer your questions is Dr. Richa Tandon, Chief of Infectious Diseases at Mount Auburn Hospital. Thank you so much for being with us.
Thank you for having me.
All right, Dr. Tandon. So Dr. Anthony Fauci seems optimistic about the national data right now, or so he said over the weekend, and he suggests that the end of the Omicron surge could be close. It certainly does look that way based on the numbers here in Massachusetts. Do you agree based on that and based on what you're seeing in the real world, say in your ER or your hospital?
Yes, I would absolutely agree that we are seeing, at least in the Northeast, a nice sharp downward trend of the new infection rate. Similar patterns as was seen actually in South Africa and other places where Omicron hit first. There are still certain parts of the US where there are rising cases, but the hope is that even there, it will be a similar trend with a rapid decline as well after they peak.
That's what we're hoping, that's for sure. The World Health Organization, we know, also added today that we may be moving out of the emergency phase of the pandemic. What does that mean?
So we've been in this pandemic sort of emergency phase for now almost 2 years. With the emergence of Omicron, what we are seeing is that it is more contagious but less virulent. Therefore, likely in its wake, it's providing some natural immunity to people. And perhaps between the combination of vaccination and natural immunity that folks are achieving after an infection, this will become more of a low virulent endemic sort of virus, almost like the flu. Thus, at least getting us out of this emergency phase is the hope.
All right, you mentioned the contagiousness. Well, here in Massachusetts, we are still seeing, even though they're on the downward slide, we're seeing more infections every day than we did during the peaks of our previous surges. So what's been the impact on that so far at Mount Auburn?
So with Omicron, we have certainly seen a rise in the cases similar to how it was back in May 2020, a much higher peak than we saw with the Delta variant. The hospitalizations have been high as well, although I have to say that was more so seen in the unvaccinated population. But the critical illness has been at a sort of a lower level, which is a good thing, again, but more so in the unvaccinated, more vulnerable population. I feel like here I have to say that the community can really help by, number one, getting vaccinated if you're not vaccinated. If you're vaccinated, make sure you're up to date with your booster. Continue masking, social distancing, avoiding large gatherings, because we're really not out of the woods yet.
Okay, well, Dr. Richa Tandon, thank you so much for your time, for your insight. We appreciate what you have to say. Thank
Absolutely.
you.
Thank you.
Thank you for having me. My pleasure.
By the way, if you have a COVID-related question for one of our infectious disease experts, you can send it to ask@wcvb.com. We'll get to as many as we can on News Center 5 at 4:30 and at 5:30.